And did you have any master's graduate program takeaways that you wanted to share with us?
I think my only thing would be similar to just making sure you remain connected with the people in your cohort, or because oftentimes you don't know where you're going to see your peers again. It's really important to build out those relationships. That's something that I think, when you're working and you're going to school and you're really just trying to keep up with everything, it just seems like another thing that you have to worry about. But truly, I can't tell you how much I've come across someone, whether I go to a conference or I'm trying to, reach out to another organization, and I notice that, oh, this person that I went to school with like works here, or see someone somewhere. Because I feel like everyone says this about their field, but public health can be a really small field too, right? You start to just know people, and especially within certain agencies, we build these networks within, this environment. So it's really important. And I definitely see and understand it can be difficult, but try to be strategic and mindful, and also think about mentors and other ways that you can be connected to people.
Yeah, you definitely never know where someone is going to end up and how that could be helpful to you. So keep those relationships and connections alive, that's for sure. So you graduated from your master's program. You might have been working at the New York Department of Health and Mental Hygiene. Was that during your master's program as well, or was that afterwards?
That was tail end of my undergraduate degree into my master's program. Yes.
Okay. Okay. So you had three positions there. You were a Hope Team Outreach Worker, which I believe was an internship, and then you got moved into research assistant for the World Trade Center Health Registry, and lastly, a chair for the HEP-free NYC Communications Committee. So can you walk us through those positions and kind of what you did in those roles?
Sure. Yeah, the Hope, which now I'm trying to remember, Hope stood for something, and I can't recall right now. But it was
So, so many acronyms in public health.
so many acronyms. Yeah, so many. My brain has replaced Hope with other acronyms that come up. But it was it was an internship. These were a group of my peers that were students at surrounding New York City colleges as well. And the health department, did this outreach to gather a group of us that were, going to school on campuses to, it really was them thinking about how they could reach college students to educate them about things like, specifically for us, we were focused on viral hepatitis. So, thinking about communications, it's having us be those trusted voices, those leaders to be able to take the information, make it digestible for our peers, and then bring them back to our campuses. So in that work, we went to different high schools, presented on viral hepatitis. So instead of this information coming from, folks that had worked in the field that were disconnected, different generation, different, ages from the people that were providing the information, we were able to share, information just using plain language, slang, and all sorts of different things to make sure that our peers were understanding the public health messaging. So there were, things around using clean needles to prevent, being infected by, blood. If someone goes to get a piercing, making sure that, again, we're thinking about hygiene and cleanliness and preventing the spread of viral hepatitis. So it was a really, really cool experience, really grateful for it. But it really was helpful in helping me then move into the research assistant role that I did, which was still at the city health department. It was just within a different department. And through that role, I got to utilize some of those initial research skills that I developed in undergrad. I got to apply it to the World Trade Center Health Registry, which, if people are not familiar, is a longitudinal study of individuals that were impacted by 9/11. So it follows the health of many first responders and other individuals who were within the impacted area. And every couple of years, I forget the exact timeline, they send different surveys out. So there's a wave 1 survey, wave 2, etc. And it's really just trying to see, and follow the environmental impacts of of 9/11. So that was really interesting for me to be able to be this not just the small study that I did, but now be a part of this larger study that's ongoing is really important. It was such a impactful thing around the world, but also in New York City. It definitely impacted the people that lived here. Even if you weren't in the immediate zone, some of the surrounding neighborhoods were impacted, and people are experiencing health conditions and various health outcomes because of it. But it was a really great experience. I learned a lot. I got to be a part of a research team and saw the different processes that they went through for publications, and was a part of that work. So that was really important. And at the same time, I was still maintaining my work with the viral hepatitis program. And this is where we built out through my work, we built out different channels to expand the communication. So it wasn't only reaching people on college campuses or high school campuses, but we started to reach people through, I built out different avenues on social media. So we had at the time Twitter, now X, we used to post on there. We had LinkedIn, we used Facebook, and then we created different pamphlets and t-shirts and brochures and resources that we would use when we did different types of health fairs and tabling events. So I was really able to refine a lot of the skills I started in undergrad, and then be able to apply them to these specific content areas.
It's awesome.